Welcome to Healing in Motion, a podcast brought to you by Healing Solutions Physical Therapy. I'm Dr. Julie Booth, owner and physical therapist.
And I'm Ashley Hayden, your master massage therapist and assisted stretch specialist. So, really quick before we get started, I really wanted to give a huge shout out to Anytime Fitness. They had a grand reopening in March and we got to be vendors. And I just really want to say a huge thank you to them. They are providing us with a recovery room out there on the west side so we can start serving the community out there on the west side. I think it's going to be a huge opportunity for us. And the fact that they were able to step in and help us out, they're such an amazing group. I love the team. I love Allie and all of her team. I just want to say thank you.
Yes, thank you, Anytime Fitness. We are really looking forward for this opportunity to grow with you and to be able to serve your community. Today, you're probably wondering who this is. Miss Tressa Jean is joining us today. She is the woman behind the camera, and so you usually don't get to see her, but we thought it was very appropriate to have her be our first guest on this show. So, Tressa Jean, welcome.
Thank you. So excited to be here, and I'm so excited for you guys to actually be at Anytime Fitness as well. Super excited to watch you guys grow.
Oh, thank you.
Yeah.
We appreciate that. So, Tressa Jean, tell us a little bit more about your company.
So I am the owner of Pandesa Media, and my company is focusing on helping small business owners like you guys or any small business owners here in the Wichita area really capture media with a purpose so they can post with a purpose.
I love that. And I love how you just make our podcast come alive for us.
Aw, thank you.
You really
Yes.
do. Miss Julie always has the great ideas. I know how to just come and wing it and be here. I'm just kidding. But you really make it come alive for us. I really appreciate you.
That is so well said. I couldn't agree more. Honestly, we couldn't have this podcast without you. Do you want to share with our viewers how this came about?
It was January, right? Very beginning of the year. You had mentioned that she wanted to start a podcast and was talking about it, waiting for her to ask me. I was like, nah, let's just do it. Let's get it started. And then we did our first
love it.
filming in January and figured it out on the way.
And here we are.
Yeah.
Yep, and you're killing it. I love it.
Aw, thank
Yes.
you.
Thank
You
you.
guys make it very easy, so I appreciate it.
We'll build each other up. But it's all very genuine and true. Like, we just absolutely love Tressa and what she does for us. So,
Absolutely.
I guess moving forward, today we're going to talk about assisted stretching. You may have heard in Miss Ashley's title, she's talking about how she now is a stretch specialist.
Yeah.
So we want to share with you viewers a little bit more about what it is, who can benefit from it, and how you can move better, feel better from getting assisted stretching.
So, what questions do you have for me?
What exactly is assisted stretching?
So, essentially, it's kind of what it sounds like. You will get a professional who is certified and trained who will guide the body through different stretching movements, either because people can't stretch on their own, don't know how to stretch on their own, or don't have the controlled ability to take their joints through the entire controlled movement. And so they need help for that deeper push, that deeper stretch. So essentially, like, we're lengthening the muscle. We're talking to the nervous system and it's allowing us to take you through the full stretch to relax. You're learning how to breathe better. That's essentially what it is. It's a guided stretch.
That's pretty impressive. I personally know I don't know how to stretch my own body, including my forearms, as Julie knows, because we worked on them. Who would you say benefits most from assisted stretching?
Anybody. If you've got muscles, if you've got joints, if you've got a body, if you're living, you can benefit from stretching. Sometimes we don't know the proper way, so sometimes it takes a professional to take the guesswork out of it for you. They don't treat the body as individual sections, we treat it as a whole system. So instead of you guessing, oh, my neck hurts, let me do some neck rolls, my calves hurts, let me do some ankle pumps. Take all of the question out of it, what should I do? We walk you through step by step a full body stretch. You don't have to think about it because sometimes pain is referred pain. I feel tension in my neck, but what if it's really coming from the middle of my traps? So we really look for those imbalances to help it out. So anybody who works at a desk, especially athletes, if you work out but you're not very good at warming up your muscles or even stretching afterwards to cool them down, some of us are really great at stretching and have the discipline and know in our routine where we need to put it. And then there's those of us that need the accountability from a stretch assistant to help them have that accountability and hold them accountable. So for anybody, that is my short answer. For anybody who just enjoys it or wants it or needs more knowledge or education on it.
really good information.
That is a lot of information
I know.
to take
just
in.
info dump right there.
Reminded me from when I was a runner and I was so good at stretching and I would
Yeah.
lead stretches and be like, because we were like a running group and I would be like, go, we got to stretch before, we got to warm up the muscles and stretch. And then after the race, we got to stretch because you got to like cool them down.
I can't help myself. I got to throw in the
No,
PT
absolutely.
side.
No, Miss Julie, you got something for us.
So this is something you getting this certification, you learned essentially assisted stretching. Now we're going to talk about the fancy words. Is it
Yes.
PNF? What the heck is PNF? Proprioceptive neuromuscular feedback. Physical therapists, we use that all the time. Massage therapists. Actually, were you not taught even in massage therapy school?
Absolutely. So I think a lot of what got me into being interested in assisted stretching was some techniques given to us through school in massage. We would do the PNF, contract and relax, different techniques to help the muscle get that extra stretch.
That deeper
Yes.
stretch.
In school, you touch on things, you talk about it, you learn it, and then you move on. And if you want to extend yourself in it, then you got to get the certifications.
That's something that I learned. I had no idea that they were teaching that in massage therapy school. And I thought that was cool. Okay, so you're doing that? And athletic trainers, they do that as well. And then aren't there other programs as well, like through NASM, for an example?
Yes. They have like, oh my gosh, what is it called? Corrective exercise. They have a course. Corrective exercise courses will also teach you kind of some PNF, some contract and relax kind of techniques to kind of push you through.
And essentially, would you say assisted stretching is designed to help improve not only flexibility, but increasing range of motion?
Yes, because not only flexibility, but also mobility, which are two different things.
Ooh, what do you want to tell us about that? What do you want to tell us about that?
So for a lot of people who are hypermobile, they can push through a stretch so well and they think, oh, I just can't get a deep enough stretch. But are you doing it in the most controlled way? Are you stable doing it? Are you having struggles? So you can be flexible and move any kind of way you want, but are your muscles actually able to take you fully through it in a controlled way? And so that's where mobility comes in.
Okay, so that brings me to you.
My hypermobility. So I was actually thinking of that because I was like, oh, because my thought of mobility was completely different. It was like, are you able to stand up and squat down really low or things like that? And I mean, that is an immobility, but having the full thought of it, having the ability to fully control it all the way down and all the way up. I've never thought of it that way. I'm hypermobile, so yeah.
Let's explain to our viewers what that means.
Hypermobility. So my easiest way is to show it. Like I'm able to touch my thumb to my wrist here, or my elbow just kind of like it goes down further than the normal, like people stop here. And mine's like, oh, it goes here. And that has caused me a lot of elbow pain, wrist pain. My knees do it. And sometimes my knees will go out of place. I'm walking and I'm just like, it's gone. I think it's hypermobility in my ankles as well because I twist my ankles all the time. And I've had to do exercises towards ankle strength to improve that ability to not twist my ankles. So hypermobility has caused a lot of pain. And when you don't strengthen those muscles, it can be more detrimental when you get older is what I found out. And it's why I've tried to improve it. Can you relate to that?
Absolutely. So I agree with what you were saying. I understand the hypermobility because I see that with people, especially in massage. They'll let me know, even when we're going through a stretch, they let me know, oh, you can go further, you can go deeper. Yes, we can. But at this point, it's going to be very compromising for your actual body, and it's not going to feel that great. So that happens. It happens a lot. And I know Ms. Julie goes through that as well with her hypermobility. I'm just surrounded by hypermobile people.
So there is a flip side to that. So I too am hypermobile. So there's a lot of joint movement. And because of that, that's caused me to tear my ACL so many times. And so like you mentioned, having your muscles, I mean, you only have so many things covering the joints, and your muscles is one of those few things, tendons as well, ligaments and muscles. And so you need to strengthen the muscles so you can better support the joint.
Is hypermobility more related to the joints?
Yes.
I just knew I had it.
And that's won't stretch people fully through that muscle movement because it is the joint that we are really pushing past. It's not the muscle telling you you can go that far. It's your joint.
So that's the difference between the mobility joint. That's why they call it joint mobility, because it's the joint. It's your elbow joint can move a little bit more fully in through that range of motion. Your muscles, they go above and below, and they attach, above and below that joint. If it's strong, it can control that mobility in the joint easier. And so that will help reduce injury. That's why we like to strengthen, strengthen, strengthen. So if you're out of alignment, you need to strengthen so you can prevent yourself from going out of alignment over and over again. So that's something common we see in the physical therapy world. So that's why strengthening is key.
It is.
Post-surgical or just in general everyday life with our active adults. So if you have any questions about assisted stretching and would like to learn more, feel free to leave a comment below and we will definitely address that in our next session.
Most people don't realize how better they can feel after just one session of assisted stretching.
Something that does get overlooked is the importance of mobility. A favorite saying of mine is motion is lotion. Sometimes you just need a little bit of help getting